Hello, and welcome back to our Riverside Chats. Today we're going to be talking about something that many of you may not have heard of: health disparities. Health disparities refers to the difference in health outcomes or access to healthcare services between different groups of people. These disparities can be based on a variety of factors, including race and ethnicity, gender, income, level of education, geographic location, disability status, and sexual orientation. The key characteristics of health disparities are inequitable distribution, social determinants of health, access to healthcare, chronic conditions, and the impact of structural inequity. That was a lot. What does it mean? Let's break it down. Let's start with inequitable distribution. Certain populations experience worse health outcomes, poorer access to healthcare, and lower quality of care compared to others, often due to social, economic, and environmental conditions. Basically, there are people who don't have access to quality healthcare, whether it's because of where they live or how much they make, for example. Now moving into social determinants of health. These disparities are often linked to broader social and economic factors like poverty, education, housing, and employment. All these things influence a person's ability to live a healthy life. Another characteristic is access to healthcare. Some groups face barriers to accessing healthcare, such as lack of insurance, transportation, or culturally competent care, which contributes to disparities in health outcomes. Chronic conditions impacts a broad range of people. Health disparities that are chronic conditions are particularly evident in the prevalence and outcomes of chronic diseases such as heart disease, diabetes, cancer, and mental health disorders. These conditions often disproportionately affect marginalized groups. Now moving on to a tough one: impact of structural inequity. Health disparities are not random. They are often the result of long-standing structural inequities in society, including systemic racism, discrimination, and unequal distribution of resources. Addressing health disparities involves policies, community interventions, and healthcare reforms that focus on reducing these inequities and promoting health equity for all groups, which is where public health comes in. One of the most important things that public health does is filling in the gaps. We have the responsibility to understand, reduce, and ultimately eliminate the inequities in health outcomes and healthcare access that affect vulnerable populations. But how? We start by identifying health disparities. Public health organizations collect and analyze data on the health of different populations, thereby identifying which groups face worse health outcomes or barriers to care. One way we do this is with community health assessments. By examining factors like race, ethnicity, socioeconomic status, geography, and other social determinants of health, we can pinpoint disparities and prioritize interventions. We also participate in health education and community engagement. Public health initiatives often involve educating communities about healthy behaviors, disease prevention, and available healthcare resources. These programs give the knowledge and the tools to those affected and let them know what they need to improve their own health. Public health is actively working to improve healthcare access. A significant part of public health work involves improving access to healthcare for underserved populations. This includes expanding access to clinics, providing transportation to medical facilities, and more. Two Rivers Public Health Department has mobile vaccine clinics within our district. We also have dental screenings for children in schools and provide transportation vouchers to help people to and from medical appointments. Now on to addressing social determinants of health. This one is a bit hard to explain, but essentially public health needs to recognize that health outcomes are influenced not only by individual behaviors, but also by broader social factors such as income, education, employment, and your environment. How do we do that? Research and data collection plays a central role in identifying the root causes of health disparities. Public health experts collect data on health outcomes and use this information to design evidence-based strategies to address the needs of underserved communities. Moving on to culturally competent care and reducing discrimination and bias. Public health initiatives aim to promote culturally competent healthcare, ensuring that healthcare services are accessible, respectful, and effective for people from diverse cultural backgrounds. Nebraska has a large immigrant population, so this one is important. This is a daunting endeavor, but one that needs to be brought to attention. Just some food for thought. As always, stay happy and healthy. Until next time.